Good afternoon.
Good afternoon, Representative.
Thank you to both chairmen and to the committee for allowing me time to speak with you today. While I am concerned with funding for education, children and youth, affordable health care, and crime prevention in this state, I'm going to take this time to address one issue in detail. I'm here to provide the human story of the behavioral health cuts in my district. These cuts have been dramatic and have resulted in a drastic decrease in the therapeutic, staff support, and the behavioral support that children are receiving. As someone who is seeing these cuts firsthand, there is no denying that these cuts are about money. Private organizations are looking at the bottom line, and these children are the ones that are suffering for it. 5 providers from Luzerne County submitted denial data for the 4-month period, September through December. The denials represent 248 children who have had over 1,570 hours per week of services denied compared to what had been previously authorized. In addition, approximately 700 hours of services per week were requested for 52 children in initial requests for behavioral health services. Only 125 hours of these were approved. These children deal with issues such as autism, ADHD, oppositional defiance disorder, and severe disruptive behavior disorder. These services are recommended by a treatment team, including a licensed psychologist. The standard for whether your child qualifies for care has been altered to be one that's a lot more drastic, where children are only eligible if they are deemed to be aggressive or self-injurious. Not only is this standard unfair to the disabled, it is absurd to say that a child is not in need of services unless they are terrorizing the classroom or causing harm to themselves. A woman in my district has 2 children with special needs. She is also a special education teacher. Her 10-year-old has Downs and has had behavioral support and therapeutic support staff for 10 hours a week. That has now been zeroed out. Her other 8-year-old son has autism and has gone from 28 hours down to 20, and she has seen results of their regression. According to the parents, teachers, and the behavioral support workers, these children who are having their services decreased are showing, or canceled, are showing signs of regression. Generally, these advances are becoming verbal, being included in the class, and completing independent tasks. And now these achievements are becoming things of the past as these children regress. With such a drastic reduction in services, teachers are now left with children in their classrooms with low-level, moderate, and severe behavioral issues. These teachers are now losing the TSS workers or behavioral support staff that were helping them with the inclusion in the classroom, and teachers are having a very hard time teaching. Also now, the burden is falling on the schools to fund paraprofessionals or aides who do not have the same educational background, and those aides are now expected to control this behavior of these children. All of these negative impacts are resulting from the funding cuts to these services. I'm kindly urging this committee to restore the funding that has caused these cuts. Thank you.
Thank you very much,
Thank you so much,
Representative.
Mr. Chairman.